Hey guys, very good evening. Happy Ayudha Puja to all of you. Thank you. We'll be starting this live talk about ankle injuries or ankle pain in a few seconds. Um, we are just waiting for the rest of them to join in. All right, so let's start today's episode of ankle pain. So I was really inspired to make this video about ankle pain or talk about ankle pain because recently I was talking over the phone to a patient of mine, and she was involved in a lot of outdoor activities like trekking, mountain climbing. She was a very active person, and she told me that somebody who's very closely related to her had stopped doing outdoor activities because he or she was unable to identify a solution to the ankle problem which they had. I, for one, believe that movement is everything for life. I believe as you continue to move, the more you move, your brain understands that this person's body does not want to stop. But the day you stop moving, your brain right away is signaled that, okay, this person does not want to do the activities which he or she was doing previously, so they want to slow down. So, my entire inspiration as an orthopedic surgeon, as a sports surgeon, and a physician is to help anybody who wants to move, and especially anybody who's interested in outdoor activities. I believe that every they should get every opportunity to sort out their issues so that they can go and explore the world, because I love exploring nature. I love uh, traveling. I was in Kodaikanal, and I was able to walk up the mountain, and I understood that if I had ankle pain, I wouldn't be able to, and I wouldn't be able to go there and see such beautiful places. So today I'm going to give you a very clear idea about a very confusing topic in orthopedics and sports medicine, that is the ankle joint. This is not going to be a comprehensive live show about all the problems of ankle, but I am going to definitely give you guys an introduction about how to approach your ankle problem if you have an issue. So let's break it down into 6 parts. First thing which we will see, I've already done it, that is the inspiration of why I'm doing this. The second thing is we will go and look at the anatomy. We will just understand what are the bones of the ankle, the main ligaments, and the tendons which are involved in the ankle. Then we will see the commonest sports injuries of the ankle. We will be looking at 6 common problems. And I believe that if you have a chronic ankle injury, that is, you've not just injured your ankle yesterday or 2 weeks ago, if you have an ankle injury for over a year or 2 years and you're unable to get rid of it, it will definitely fall in one of the 6 categories which we are talking about. After that, we will talk about a common problem in ankle diagnosis. That is, sometimes MRIs and X-rays are inconclusive, and we will talk about why they are inconclusive. And finally, we will talk about a very easy way of treating ankle injuries non-invasively. That is, without a knife, without surgery, without sutures. I will explain what it is and how we go about it. So that is going to be the gist of our first ankle episode. So let us understand anatomy of the ankle, and here comes our bone model. So if you pay attention, the ankle is made up of 3 bones. That is, the big bone is your tibia. I'm sorry, guys. I'm just going to put my phone on mute. Thank you. So here we go. The big bone which you see here is the tibia, and the small bone is your fibula. Now, this this bone which you see here, okay, which is like a semicircle, is your talus. So the bony structures of your ankle joint are just three bones, which is the tibia or the big bone, the fibula or the small bone, and the dome on which both these sit, which is the talus. Now we have ligaments on the side, that is the lateral aspect or the outside, and the medial aspect or the inner aspect. These are extremely important ligaments known as the lateral collateral and the medial deltoid ligaments. And these ligaments are responsible for our sideward instability. When we run, every time our ankle slips and it does not dislocate, the reason is that these ligaments are tethering them in place. Then we have a very important structure which is in the back in the ankle, which is known as the tendo-Achilles or the tendo-calcaneus tendon. It is not visible in this bone model, but it is a tendon which arises from the calf muscle and attaches onto the heel bone or the calcaneum. Now, if you notice, there is one thing very peculiar about the ankle. It is that the ankle is like something sitting on a dome. So most of the ankle injuries occur because of the anatomy of the ankle. The ankle is a separate joint and the foot is a separate joint. Most of the time, when your foot is fixed and your ankle moves in a different direction, you have injuries of the ankle. So if you are stuck in a ditch and you move where your foot is stable but your ankle twists, that is when you have ligament injuries of the ankle. Now that we have covered the anatomy, what are the 6 possible commonest sports injuries of the ankle? We will divide it into ligament injuries, cartilage injuries, and synovial injuries. 3 things, okay? After that, we will also add one bony injury to it. Okay, so there are 3 ligament injuries which are possible. If you have any pain in the outer aspect of the ankle, closer to the small bone, you could have an injury of your lateral collateral ligaments or LCL. If you have pain in the inner aspect of your ankle and you have pain when you are moving your foot outwards, you could have an injury of your deltoid ligament or the inner ligaments of the ankle. Finally, if you have any pain in the front of the ankle, remember that there is a possibility that you could have an inflammation or an injury in the synovium. Synovium or the capsule is a structure which protects or covers the ankle joint. If it is inflamed because of repetitive stress to the ankle, you could have a pain in the front of the joint. Pain in the front of the joint could be a synovitis, and a synovitis could also extend onto the mid portion of your foot, as the ankle and the foot are connected via the synovium. Then you could have a tendo-Achilles issue that is very similar to the injuries on the inside, on the outer side, in the front. If you have any pain at the back side of your ankle, it could be a tendo-Achilles inflammation. Then we also have, if you look at the ankle, can you see these spaces here on the inner aspect and this groove here on the outer aspect? We have tendons which come from the calf and go through the ankle into the foot. And it is only because of those few tendons we are able to move our ankle up and down. So another injury or another reason you could be having ankle pain could be a tendinitis or inflammation of the tendons, that is, which are moving your ankle up and down. On the outside, these are the peroneal tendons, and those are commonly affected. So if you have pain on the outer aspect of your ankle every time you're running or walking or you're rotating your foot, think of a peroneal injury. So these are the 6 soft tissue injuries. What is that one bony injury which I spoke about? Many times in runners, those who use their foot to climb, who put pressure on their foot, there could be a fracture of the bone which is known as the talus. Okay, that is the bone which is right here below the big bone of the ankle. And there could be a condition where fracture of that bone cuts the blood supply off to a part of the talus, and a part of the talus could die. That's called avascular necrosis of the talus. So if you have ankle injury and you've been struggling with it for a long time, these are the most common possible diagnosis. Now, coming to an X-ray and an ultrasound and an MRI scan. Now, most of the time, an X-ray shows just injuries in the bone. Yes, we can identify injuries of the ligaments by identifying if there is any increase in the joint space and by also doing stress views, but still it is speculation. The next investigation is an MRI. An MRI is a good investigation if you have a complete tear of ankle ligaments. It identifies it very, very well. But if you just have a partial injury, or it's just torn in between the ligament or through the lines of the ligament, an MRI does not identify anything more than edema around the area or fluid accumulation around the area. The reason is, most of the time, ligament injuries which are partial or even which are total, they can be identified only if there is a strain on the ankle. Okay, because when a ligament is not stretched, you cannot identify if it has a partial tear or not. The problem with an X-ray and an MRI is we take the imaging in static mode. So you are asked not to move. And that is the reason we are unable to tense the ligament or stress the ligament on an MRI and identify if there is a tear. And also, different ligaments of the ankle require different positions of stress. So in a single imaging of an MRI, it will be extremely difficult to stress the ankle and identify. And that is the reason many times if you have a partial injury of the ankle, it is missed. So what is the solution? The solution is a dynamic high definition ultrasound examination of the ankle, where we can identify all the ligaments of the ankle, including the tendons, and each and every ligament can be identified and stressed to see if there is a tear under vision. And partial tears, complete tears, and linear tears also can be identified depending upon the skill of the expert doing it. So if you have had an ankle injury and you think that you have a ligament injury, okay, but you're unable to identify, the MRI does not show, find some orthopedic surgeon in your city who is able to do an ankle ultrasound, a dynamic ultrasound of your ankle, and get your ankle assessed. Now, coming to treatment, okay, treatment for chronic ankle injuries. I'm just going to talk about ankle injuries which have already been treated with physiotherapy and exercises and medication. Okay, you have tried all that and it's not working. So the first step is you do a diagnostic dynamic ultrasound of the ankle ligaments and tendons to identify where the problem is. If you have instability of the ankle, that is when you walk, your ankle slips, that is a different topic. Okay, we will, if any of you would like me to talk about it, I will. But here we are talking only about ankle pain, not ankle instability or slipping of the ankle. So if you have ankle pain, most of the time it will be a partial injury to any of the ligaments or an inflammation of the tendons. Sometimes it could also be an injury to the cartilage in your ankle joint. and under ultrasound vision, injection of platelet-rich plasma and bone marrow concentrate targeted into the ligaments and the tendons using ultrasound is a very good method of enhancing healing in those areas. So basically, PRP is platelet rich plasma. Bone marrow concentrate is concentrated stem cells and healing cells which are harvested from your bone marrow. These are very rich in healing, and each of them have cells which can regenerate tendons, ligaments, muscles, bone, and nerves. So we identify which are the areas in your ankle, which are the ligaments, which areas there are loss of cartilage, and using ultrasound, we localize the areas and the healing cells are injected into those areas with ultrasound guidance. There is no scar, we don't use a knife or repair it. So the growth factors and the healing cells are delivered into tendons, and studies, results, and evidence shows that this provides 60 to 70% improvement in partially ruptured ligaments of the ankle. And if you rehabilitate, exercise, strengthen your muscles, then this is a very good non-surgical way to treat your ankle ligament injury. Now, when it comes to ankle instability, the treatment might have to be surgical depending upon what your issue is. Here, we are only talking about ankle pain, chronic ankle pain. All right, guys, I hope I was able to give you guys a clear idea about how to approach chronic ankle pain. And if you have any doubts, please feel free to ask me. And after this, I'm just going to stay on to see if there are any questions and answer your questions right away. Thank you so much for watching till now. So I have a question. Pratiksha Dholakia asks me, my right ankle is painful and a little swollen on waking up. What could be the reason? Similarly with the left ankle. So I need a little more information if you've had an injury or if it is happening just recently. I'm just going to assume that it is recent and you haven't had an injury. If it is happening in both the ankles, okay, you have to make sure that it is not an inflammatory problem first, like an arthritic issue. So what I would advise is you can get a series of blood tests done just to make sure that you don't have any inflammation in the blood, like an ESR, CRP, just the basic tests for inflammation, and also do an X-ray of both your ankle joints. If it is an inflammatory pathology, that is, if you have the pain because of inflammation and not injury, in the X-ray you might sometimes see a shadow of the synovium, that is the soft tissue around the ankle joint will be swollen. And if it is so, then you can do an MRI to see if you have synovitis because of inflammation or not. If you've had an injury, then I would definitely advise you to go for an ultrasound of the ankle so that a dynamic evaluation of the bones, the tendons, and the ligaments can be done, and we can identify why this is happening. All right. And okay, guys, as of now, the questions are done. Thank you so much for watching. If anybody of you are watching from Chennai, hey, send a message to say if you liked it or not. And if any of you are watching from Old Mahabalipuram Road or ECR, a big hi, we are neighbors. Tell me if you watched the show and tell me if you liked it also. All right, guys. And also, if anybody of you are lovers of outdoor activity and ankle issues are not letting you do what you would like to do, I consult free on Tuesdays, and I would really like to help out anybody who wants an opinion about why something is happening to them or what they need to do. And please call on Tuesdays. You can actually fix up the appointment on Tuesdays. My entire slot is free, so that I can help those who need guidance. All right. So, hi, Senthamil. Thank you so much. So, please sort out your ankle pain. All right, guys. Bye bye. And also, don't forget to join me Saturday, 6 p.m. for the Saturday Ortho Show. This week's show is about disc pain and disc bulges and why some people need surgery and why some people get all right with just physiotherapy. And I'm also talking about a new complication of the COVID-19 vaccine known as tinnitus. And then I'm also giving 3 exercises for sacroiliac pain in that episode. So if you're somebody who thinks that you will be benefited by that, Saturday Ortho Show at 6 p.m. hosted by Dr. Santosh Jacob, that is me. All right, guys. Bye-bye. See you soon. Thank you so much for watching once again. Bye-bye.